on the station that's on your side. This is Channel 7 News Daybreak.
All right, 6:23 is the time. We know research shows that reducing trans fat in the American diet helps reduce the risk of heart disease. But how and why, and really what is trans fat? Let's try to clear up the confusion this morning with the help of Baptist Health cardiologist Dr. Scott Davis, back from the holiday. Great to see you.
Thank you for being here.
Thank you very much.
Yes, you're in our life.
You're the experienced dad, so I'll get some advice from you about that a little bit later.
Yeah, trans fats.
Yes, let's talk about that first.
First of all, what are they? They're naturally occurring fats, and then there's these artificial trans fats. So, food like meats and milk products have a little bit of trans fat in them naturally, but then the artificial trans fats, the trans fatty acids, or how they're sometimes labeled, is what we're focusing on. When the industrial process will take vegetable oil and add a hydrogen to it. So that's the partially hydrogenated fat that you might read about. Look for it on labels.
Okay.
Why do we even?
What is that?
Yeah, what is it? Right. That first of all, it's easy to use, it's inexpensive, and it lasts longer in the food processing process.
Okay.
So that you deep fry foods at a restaurant with partially hydrogenated fat, and it lasts longer. It doesn't degranulate. You can use it over and over and over again, and so it starts showing up in French fries and donuts and then other processed
all the tasty
foods.
stuff,
all the good stuff.
Yeah, exactly. Yes, but heart health wise,
right?
Yeah.
So heart health wise, starting back at around 1990 is when we started looking at this, because the process started to really evolve, and then we started looking at the health effect, and then we started realizing, at least on the cardiology side, that there's a negative effect. It starts to raise your LDL, the bad cholesterol. It lowers your HDL, and it increases your risk for heart attack and stroke. So what has happened? Well, in certain places now, we've done studies where we've looked specifically at eliminating the trans fats in your diet and the impact on overall risk for having a heart attack, risk for having a stroke. So the most recent study that's come out, very interesting study that was done in New York State, okay? 11 counties from like 2007 to 2013 that mandated no trans fats in restaurants.
Really?
Right? Got rid of all of them, okay?
Wow.
And then they studied, then compared to the other 25 some odd counties in New York that didn't have this ban.
Okay.
And there was a reduction, a 6.3% reduction in admissions to hospitals in those counties for heart attack and stroke that lasted 3 years or more.
That's incredible.
It really is impressive.
So substantial evidence now showing.
Right.
Yeah.
And so, so now the FDA, starting in 2018, is going to put a mandate that's going to restrict the trans fatty acids in processed foods and in restaurants.
And stuff like that. Yeah.
So, I mean, you can fall on one side or the other about, how much government you want in your life.
Sure.
But, the FDA is really doing a good thing here based on good data to eliminate this. So, still be label conscious. Look, you are what you eat, right? And so we tell people, you really want to be label conscious about, what you're putting into your body. But still, the government has mandated that it has to have trans fatty acid or, partially hydrogenated on the label. Pay attention to that, because you want to reduce that in your world and in your diet. It will directly impact your heart attack and stroke risk.
Fantastic. Dr. Davis, thank you so much for coming in.
Happy New Year, sir.
Happy New Year to you. Baptist Health Healthline on your screen.